in your book, The Untold Stories of Infertility, you shared some nuanced details on how patriarchy takes a huge role in shaping the discourse around infertility. Do you believe we may help, like may AI may help in normalizing this discussion around having infertility treatments, or are we still looking at that gap? Are we still not able to have a proper normal conversation with our families about IVF treatments?
Yeah, AI has nothing to do with infertility and the emotions, unfortunately. Like it's just about machine learning and putting in data, getting, the results
Mhm.
out. That's it. But infertility, that's what I'm trying to say in the book, that infertility is not even about medical procedures or just a medical condition. It's very much an emotional one. And that is what is being ignored all the time. So doctors are just focusing on advances, on treatments. And of course, I'm excited about artificial intelligence and how it can improve the success. But unfortunately, I don't think yet that AI is going to have emotions, feel the emotions of the person. In an infertility treatment, it's such a roller coaster of emotions. They go through so much emotional turmoil. For example, just give an example. There's so many emotions involved. A typical emotion is that of sadness, depression. They begin with that. Then there's anger. They're angry with themselves. They're angry with God. They're angry with their partners. Then there's guilt. You feel guilty about practically everything you do when you did, when you were a teenager, or was in childhood, or what you're doing. Then there's blaming. You're blaming your partners. You're blaming your mother-in-law. You're blaming everybody. And there's so much of, grief, so much of suffering. So unfortunately, AI is not going to be helping with the emotional angle. I do hope that these avatars, the AI avatars, what they say, may be able to manage in a particular way. And of course, that is another angle of it, because today doctors don't have time to sit and listen. So we have counselors, we have psychologists, we have psychiatrists, but today we also have what is called the AI generated avatar. In fact, I have one on my website, which is drmalpani.com or ivfindia.com. So because it was very hard, we're getting so many messages on WhatsApp, it's very hard to counsel everybody. So we have this avatar who comes in and actually chats with the patient on a chat bot. So, but that's the limitation. You can only ask certain number of questions. The actual treatments have to be done by the doctor or the counselor. The actual emotional treatments, I would say.
Yeah, yeah. That's maybe a relieving thing to hear about.